I'm Mary Beth Sewald, President and CEO of the Vegas Chamber. This week, we are very excited to be doing our annual Washington, D.C. fly-in, albeit virtually, not actually in Washington, D.C., but we still wanted to make sure and bring you the very latest on updates and so forth from our nation's capital. Very pleased today to have Katie Mahoney with us. She is the Vice President of Health Policy for the U.S. Chamber. Thank you so much, Katie, for being with us today.
Thank you for having me.
Well, we really appreciate it because, for one thing, we know that healthcare is just so vital to our businesses, certainly in providing affordable health insurance and now in protecting all of us from COVID-19. So can you give us kind of an idea of what is the latest from Washington, D.C. on healthcare policy, especially with the impact of COVID?
Sure. So there's sort of big picture and small picture. I think and small picture meaning more narrow, nothing small in healthcare, I suppose. Right now, the nation and the district are really focused on getting a phase 4 package enacted. It's been something that's been kind of fits and starts for several weeks now, several months now. I was remarking that we sent our letter up to Congress about what we thought should be included in a phase 4 package July 16th. And here we are really 2 months later in September, still trying to get a phase 4 package enacted. Our priorities for the phase 4 package with regard to health, but also with regard to our economy is enacting liability protections that will address concerns for businesses in the short term. So as companies across the country are trying to do what's right for their employees, for their customers, for the local communities. And as those businesses are following CDC guidelines, recommendations of local health officials, we want to make sure that they are protected from rogue lawsuits and those that are looking to make a buck at a time when things are so uncertain and things are constantly evolving. And so we want to see liability protections on a temporary, timely, and targeted basis, a limited basis during the time of this pandemic, to protect businesses from product liability, exposure liability, medical liability, and security liability, so that these businesses can do what they see as right in terms of following local guidelines and opening up to serve their customers and keep their employees working. The other piece of sort of the more short-term goal with the COVID phase 4 package is looking to try to protect those individuals that have lost their jobs and potentially have lost insurance with their jobs. And so trying to enact a federal subsidy for COBRA, again, for a limited duration, but something that within the kind of the scope of 90 to 95% of a federal subsidy that would keep individuals on their employer-sponsored plan, allow them to get coverage and treatment during this pandemic and not be subject to a new deductible, trying to navigate a new formulary and a new provider network. So those are sort of the immediate challenges, I think, facing Congress at this point.
Wait, Katie, there sure is no shortage of things to be doing and looking out for in terms of the healthcare industry, especially during this time. So we really appreciate all that you're doing. A few years ago, and as you know, the Vegas Chamber was one of the leaders across the country in the association health plans that were issued or that were made available. Through association health plans, chambers like ours was able to provide affordable, robust healthcare to people. And then there was the district court case that was filed. Can you give us sort of a status update on what is the status of association health plans?
I can give you a status. It's not really an update because it's the same status that we've been waiting on now for such a long time. And it's really unfortunate and frustrating, I know, for not only associations that had to put these tremendous plans together, but for employers and employees that had enjoyed that coverage. We had expected that the appellate court would rule in early 2020. Our leading litigators at the Chamber's Litigation Center had expected March, and we're still waiting 6 months later with no decision, no inclination as to when we may get a decision, sadly. folks that are trying to read the tea leaves, I think, thought that the oral arguments went pretty well for those that wanted to see the rule upheld. I think folks now are seeing the tremendous delay in getting a decision as possibly a reflection of a split bench. And so we may, that may be why the opinion is taking a while to kind of either get written or finalized or both. But we, continue to support the regulation and those chambers that did tremendous things by expanding coverage as they should and could be able to do under the regulation.
Well, and we were fortunate because we're still able to provide our association health plan at least through the end of this year, but that's coming pretty quickly. So,
Yes.
so we shall see, right? In addition to a vaccine, reliable vaccine, what would you say needs to happen to tackle the coronavirus in order to open up our economy again?
I think that's such a good question and something that I've really been trying to encourage folks to think about, because as we know how politically charged the nation is and the climate is and how divisive things unfortunately seem to be with regard to so many different things, it does seem like there's again sort of a polar position of folks that seem to say, once we're going to get a vaccine, we're going to get it soon, and then we're going to be able to reopen, and that's going to be the panacea. And I certainly am an optimistic person and would like to think that a vaccine is coming. But I think there are also other experts that have long operated in the pharmaceutical and innovative space that say, look, it's taken 4 or 5 years for us to get the fastest vaccine ever developed out. And we are 6 months in. And so to expect that we're going to get a vaccine within, months of this pandemic is unrealistic. And I sort of am in the middle of both of those places. And I think, the questions about once you get a vaccine, what else do we need to think about? There are folks that are saying that the efficacy of a vaccine is going to be 30%, which means even those that get it may not be protected. There are statistics that show 1 in 3 people are willing to get a vaccine, which speaks to concerns and fears about being the first tranche to experience that innovative treatment. And so I don't know that a vaccine, to your very point, is sufficient. And so one of the things we're doing at the chamber is looking at all the elements of distribution and all the elements of the supply chain as far as the way vaccines are brought to populations. And are there ways to improve that supply chain, but also to try to address different communities that may, for very valid historical reasons, have trepidation about getting a vaccine. And so really trying to think about it from many different angles and not just sort of putting all of our eggs in the basket of once we get a vaccine, we'll all be okay.
All right. Well, Katie Mahoney, thank you so much for all you do at the U.S. Chamber and on behalf of all of us across the entire country. We really appreciate all your work.
Thank you so much. So nice being with you.
All right. Thanks again. For all the latest details about the Vegas Chamber's Washington, D.C. virtual fly-in, you can follow us on social at Vegas Chamber, LV Chamber, and you can look for the hashtag DC in LV. That'll do it for this time. I'm Mary Beth Sewald. Thank you.